Welcome back to the Diabetic Foot Files. It's me, Gabby, or Dr. G, and you would not guess what time of the night it is. It's around, I think, about midnight, and I could not sleep. So I was like, okay, let me think of another topic to cover when it comes to diabetic foot care. So, as you know, the Diabetic Foot Files, we dive deep into diabetic foot care, real stories, and real strategies to help prevent amputations and complications. So, today we're going to focus on something that affects millions of people, but it often goes unnoticed until it's too late. What do you think it is? Diabetic neuropathy. I'm sure you've heard that term before. So, diabetic neuropathy, this isn't just about tingling and numbness and burning sensation. It's about losing sensation in your feet that can cost you your independence or even your limb. But the knowledge is power. And today we're going to give you the tools to spot it and be able to manage it and stop it in its tracks. Not complete neuropathy, but it does play a huge role in in evaluating the risk for a diabetic ulcer. So, what is diabetic neuropathy? Diabetic neuropathy is nerve damage that is caused by the high blood sugars over time. It affects about 50% of people with diabetes, but what is the real danger in that, right? You're like, oh, well, they have nerve damage, but it often starts silently, okay? There's different types of neuropathy. So we have peripheral neuropathy, which is the most common, and that affects the feet and the legs. Then we have autonomic neuropathy, which affects the internal organs. Then we have proximal and focal neuropathies. These are rare and it affects a particular nerve or particular areas. So, what are the symptoms of neuropathy? You have to look for the numbness or loss of feelings in your feet, tingling, burning, shooting sensation, also temperature sensitivity. You might experience some muscle weakness or balance issues. But another other thing that stands out when we're trying to evaluate for diabetic neuropathy and we're trying to get our history from the patient, we usually ask the patient, how's the pain at night? Does it get better or worse? And most often than not, patients who have diabetic neuropathy say that it gets worse at night. So, when you lose a sensation in feet, you don't feel when something's wrong. You honestly, you would think not feeling pain would be a superpower, but it pretty much is a double-edged sword. You can't feel. You need to feel. You need pain to tell us that, oh, like alert, alert, something is wrong. So if you step on a nail or develop a blister from a tight shoe or burn yourself without realizing it, people who have diabetic neuropathy, they can't feel these injuries. You have no idea how many patients, especially during the summertime, they come in with second degree burns most of the time because they've been going to the beach, walking in the hot sand, but they cannot feel it because they have diabetic neuropathy. So because they cannot feel it and also they didn't do what? Did not follow the 60-second rule, checking the feet at the bottom every day. These injuries can get infected fast and then spiral into an ulcer, an infection, or then into an amputation. Usually, if you just go make it go unnoticed. If you check your feet every day and you see that the area looks burned, I would go right away, next day, or even to the ER. So, like always, let's start with a real life case. The man who walked on a wound. I mean, that's pretty much every diabetic ulcer that I've seen. So let me tell you about Robert. He's a 64-year-old man with type 2 diabetes. He's been managing it decently and he ignored his neuropathy. Then one day he wore a new pair of shoes without socks. I mean, sometimes we do, sometimes we don't. But he didn't know that the shoe rubbed deep and he developed a blister into his heel. So he kept walking on it for about 2 weeks because he couldn't feel it. By the time his wife noticed a smell coming from his foot, the wound was already infected and full of pus. I remember when I was a student and I was presenting to attending, and I was trying to explain the wound and the drainage from the wound, and I said, I was like, "Ada is like pus," and the lady's just like I was like, it was like, it was just I said it wrong. I said it in the wrong manner, and she told me the right way to say it is purulent. Okay, so when you're presenting to the attending, say the drainage was purulent. Okay, purulent drainage. Okay, back to Robert. So the x-rays show that the infection did spread to the bone, which is very common. And unfortunately, the patient would need a below the knee amputation. But Robert didn't feel anything until it was too late. And remember, if first episode we talked about that sensation lost, and usually if it gets really bad, the infection gets really bad, that's when they start feeling it. And that's even more concerning. I'm like, oh, no, no. Like, we got to go to the OR right away. So, another pearl just to remember, if somebody has a wound on their heel, that is a really big deal because having osteomyelitis in the calcaneus, it's really difficult to manage. And sometimes people have something called a calectomy, like they're removing a piece of that bone in the calcaneus, which is your heel bone. But you have to also remember then there's the ankle joint, and then there's the tibia and fibula, and then there's your knee. So that's why it develops so quickly into a below the knee amputation because the calcaneus is it's directly distal to the knee. So exactly if the infection is going to the least path of resistance, which is proximally most likely, that's why he needed a below the knee amputation. It didn't go forward; it went up proximally. Okay, so let's talk about what we can do, whether we have symptoms or not, when it comes to diabetic neuropathy. So, another thing, one of the biggest things that you do when you go into the doctor, they're going to ask you, "Hey, I want you to close your eyes and tell me if you can feel me." And what they're going to use, it is standard of care to use a monofilament. It's like a strong little piece of fish wire, but it's not wire. It's really like a strong piece of plastic, pretty much. And we're supposed to touch different parts of your feet, and you're supposed to tell us where and if you feel it, but you have your eyes closed. Because if you have your eyes open, you're just going to say yes, even when you don't feel it. So that's why. So if the patient doesn't feel it, then I would say, okay, you have lost protective sensation and it makes you at high risk of having a diabetic ulcer. And that type of patient, especially if they have calluses, corns, any areas of redness or increased pressure, I would see them monthly. If they have any open wounds or anything like that, you have to see them on a weekly basis or every 3 days if you're changing a wound or daily. Or schedule about daily wound care or wound care dressing at their home. So, what can we do when we have diabetic neuropathy or any type of neuropathy? Some people even get neuropathy from chemotherapy. There's different causes of neuropathy. So, one, we can do daily foot checks, like I said, aka the 60-second rule. So, you inspect the top and bottom of your feet and in between your toes. Like I said, use a mirror or get a family relative. What is family for? And then you look for blisters, areas redness, cuts, dry skin, color changes, and swelling. Now, number two, footwear matters. Wear safe diabetic shoes with wide toe box. Okay, so I know everybody likes to look good. I'm not, only because I'm a podiatrist, I look down at people's feet so much, but I don't pay much attention if I wasn't a podiatrist to people's shoes. But a lot of people don't want to wear diabetic safe shoes. They're like, it's ugly. But I'm like, in my head, it will be a little bit more uglier to lose your foot. So what would you rather? Let's wear the ugly shoes then instead, because I rather save your pretty feet. Now, also, you're supposed to avoid barefoot walking, even if it's indoors. You're going to hear me say that even when it comes to plantar fasciitis. Don't walk barefoot. Let's just save us time and energy. Don't walk barefoot. And then I always say check the inside of your shoes. They always have those weird shows, always sent me to the ER. Those scare me. But checking your shoe, oh, there might be an insect in the shoe. I'm not feeling that, but I just check your shoe. Now, number 3, keep your blood sugar under control. So, the better your blood sugar is controlled, the less damage to your nerves. And also keep your hemoglobin A1C regulated and recommended by your doctor. So the hemoglobin A1C, what is that? Patients always ask me, what is that? It is a blood test to test how well your blood sugars are regulated. So they literally draw your blood and it tells us how well the blood sugars are within the 3-month span. We want to keep it like 6.5 and below. The higher the hemoglobin A1C, it's going to be percentage. It's going to be 6, 5, 10, 12. I've heard people say 14, and I'm like, oh my gosh, what are we doing today? Like, that just means that you're just letting it all happen. Well, we want the hemoglobin A1C to be 6.5 or lower, okay? And if your hemoglobin A1C is higher than that and it's not trending down from your diabetic medication, then you should talk to your endocrinologist about possibly evaluating another diabetic medication that can help with regulate your blood sugar better. Forgive me for that. So for moisturize, but like I said, moisturize wisely. Use a diabetic safe lotion, especially along the heels, prevent those cracks. And then 5, regular checkups, see your podiatrist regularly. And even if you think your feet are fine, and then you can ask your doctor for a monofilament test to assess your sensation. So what do you do if you already have neuropathy? While nerve damage is quite difficult to reverse, there are still treatments out there to help manage the symptoms and prevent further decline. So medications like gabapentin, aka Neurontin, pregabalin, Lyrica can help with nerve pain. Supplements like alpha lipoic acid or B vitamin complex. You have to talk to your provider at first, okay? Your primary care doctor about that first. Those are found over the counter. There are therapies, which new therapies. Usually I've seen it with physical therapists, or you can go to your neurologist about the new therapies that help treat it. Also, foot massages, TENS unit acupuncture. Some patients I've heard have some relief from that. Also, there's some specialty socks that are designed for diabetics to help with neuropathy, which is kind of interesting. But remember, the goal is to prevent new damage and protect your feet from harm. Okay? And I'm sorry, I'm going to keep on saying it, okay? So, neuropathy isn't just numbness, it's about losing your ability to protect yourself, and that's serious. But the good news is you have the power to prevent these complications with the daily foot checks, proper foot care, good blood sugar control, and regular medical care to keep you one step ahead of the neuropathy. Sometimes I want to see if like neuropathy could be, like I said, like a superpower, like super neuropathy. But it's not helpful not to feel pain. It, it does help a little bit in the ER if you have to do emergency IND and you don't have to numb the patient up because they don't feel anything. But besides that, no. So, what are the key takeaways from today's episode? 1, diabetic neuropathy is common. The higher the blood sugar, the higher the hemoglobin A1C, the more likely you're going to have complications and experience symptoms of diabetic neuropathy, such as that tingling, numbness, burning sensation that comes worse at night. And if you ignore it, you're going to be at high risk of developing a diabetic ulcer because you cannot feel as well as normal people. Then prevention is cure. That's what I say. Prevention is everything. So check your feet every day. 60-second rule. So thanks for tuning in to the Diabetic Foot Files. If this episode helped you, please share it with someone who you care about. And don't forget to subscribe, leave a review, and follow us on social media for more life-saving tips. Until next time, take care of your feet. They take care of you. Take care of you. Take care of